So, welcome. This is Health Literacy 101, an overview of the field. My name is Michael Villaire. I'm CEO of the Institute for Healthcare Advancement. We are your hosts for this conference. Thank you so much for being here. We really appreciate you guys being here. Thank you. So, without further ado, let's go ahead and get started. So, we're going to start off with a few of our objectives. Always a good idea to start off with where are we going to go today. And sometimes, so here's your first health literacy lesson. A lot of times you'll see these things listed as learning objectives. What does learning objectives mean? What we're going to do, what we're going to learn. It's very simple stuff. So here's what we're going to do today. We're going to learn about health literacy, start off with some definitions, and talk about health literacy and the prevalence of poor health literacy in the United States, talk about the general characteristics, abilities, and challenges of those with poor health literacy skills, and describe 2 strategies for more effective communication. Essentially, when you walk out of here, what we want to do is we want to set the stage for you. So if you're brand new to this field, the community, health literacy, we want to kind of just raise your awareness first so you can sort of understand why we all are so passionate about this particular field, this endeavor, and talking about health literacy and talking about solutions, because really that's what this is all about, is finding solutions. So let's jump in. So some definitions first. So people say, well, literacy, health literacy, aren't they kind of the same thing? Well, in a lot of respects, there's a lot that overlaps, but there are differences. And so literacy, here's one definition that's as good as any: using printed and written information to function in society, to achieve one's goals, and to develop one's knowledge and potential. Literacy is essentially your ability to read and write and to be able to communicate with other people, in our society, okay? Health literacy, a little bit different. Now, there's a number of different definitions for health literacy. In fact, the National Academy of Medicine Roundtable on Health Literacy, formerly known as the Institute of Medicine Roundtable on Health Literacy, just published a paper on considerations toward a new definition for health literacy. So if definitions of health literacy are something that is of interest to you, that's a great paper, and I think it's going to be in your tote bag at the end. So this definition, Scott Ratson and Ruth Parker came up with this definition a while ago. It was first quoted in Healthy People 2000, and it was also used in the IOM original report, Health Literacy, A Prescription to End Confusion. Health literacy defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. It's kind of a mouthful. Essentially, what we're really talking about here is people's ability to function within the healthcare system, all right? One of the examples that I like to use is financial literacy, okay? So, I've got a 401k, actually 403b, because we're a nonprofit. So we've got a 403b. I have money taken out. Every now and then I look at it and I'm either like, yay, or, but I know that, if the market goes up, my thing is going to go up. If it goes down, it's going to go down. If somebody said, explain the stock market to me, I'm like, I have no idea. I know it's there. I know that there's numbers, and if they go up, it's good. If it goes down, it's bad. But I don't really kind of understand the inner workings of it. So similarly, most of you in this room, I'm assuming, work in some capacity in the healthcare field. And so when we talk about terminology and language and things that affect healthcare, you sort of understand that. But remember, there's a whole other group of people who only interact with the healthcare system when they are not well. And so it's a foreign system to them. So when we talk, and we talk in terms and, jargon and information and health, that sort of language, it's a little bit tougher for people to understand. So that's what we're going to kind of really cover here today. So this initial definition of health literacy, it gets at the general point, but it's not quite exactly the, right on target. So here's another one from AMA. Health literacy is the ability to read and comprehend prescription bottles, appointment slips, and the other essential health-related materials required to successfully function as a patient. How many of you have taken that course? How to successfully function as a patient? Seriously, you guys haven't taken that class? There is no, it's always one wiseacre in the back. Yeah, I took it. No, there is no class on how to be a patient. How do we learn to be a patient? We get sick, we go in, we try to understand what people are telling us to do, we try to do it the best we can, and we learn a little more each time, hopefully. But there is no successful There's no course on how to be a successful patient. We know this stuff or we don't, and we either learn it or we have issues and problems that occur, and we'll look at some of those coming up here. A few other definitions. This one is actually probably the one that I like the best. Oops. This is a group got together in 2008, and they wrote a document called the Calgary Charter on Health Literacy. This definition, health literacy allows the public and personnel working in all health-related contexts to find, understand, evaluate, communicate, and use information. What's the critical difference between this definition and the previous ones? The difference here is that the healthcare system now has a role and a responsibility in this whole health literacy equation. It's not just your ability, how well you can do this, how well you can understand what we're telling you, but it's like we have a responsibility here too. We have some skin in the game, and we have to be able to let people know in clear fashion what we want them to do, what their health is all about, what their situation is, how to use their health insurance, all of those sorts of things. We have a responsibility. It's not just either you get it or you don't. It's how well do we communicate. And so frankly, that's what this whole conference is really about. We want to make sure that we all understand that there's roles on both sides here, and we have control over what we do and how we interact with everybody else, and hopefully that'll ease some of that particular burden. So what comprises health literacy? What are the pieces that all go in there? Well, there's a number of different pieces. Reading and writing, quite obviously. Patients need to read. They need to write certain bits of information. Us on the healthcare team need to be able to read and write and to communicate with everybody else. Listening and verbal communication. This is such an important piece. Now, right now we're in a room and I'm giving a lecture, a talk, so it's not really a conversation. A lot of times when we communicate information to patients, to healthcare consumers, our stakeholders, whoever they are, that's sort of a one-way thing too. We may write something down and give it to them. If we're a clinician, we may say, here's what's wrong with you, here's what you need to do. But really where the richness comes in and where our ability to interact and make a difference comes in is in that conversation piece. And that involves critical listening skills. So it's a back and forth conversation. I say something, you receive that message, you process that message, you say something back to me, and hopefully we're building towards something rather than just me doing a just a dump of all my information to you. All right, I told you, now you know, now I'm going on to the next one. Well, I told you, but it doesn't necessarily mean you know. It doesn't necessarily mean you understand. There's a lot of other components. How many people were in the using teach-back session earlier today? Okay, so you know what I'm talking about, right? Numeracy. This is an incredibly, a lot of times overlooked area of health literacy. It's our ability to deal with not just numbers, but equations, rates, ratios, percentages. We're going to talk about some of those things in a moment. Computational skills. So here's an example. You get a prescription bottle, and the prescription label says, take 1 pill 4 times daily. Now, here's what the problem is with sitting up toward the front of the room. It's because you end up getting picked on, and I'm so sorry. But so you get this prescription, and it says, take 1 pill 4 times daily. When would you take those pills? No idea, exactly, right? Well, those are right. Yep. So, but in terms of time, if you have to take 1 pill 4 times a day, tell me how you would take those.
When I wake up in the morning.
Okay. What time do you wake up?
6:30.
6:30. Okay, one at 6:30.
One at lunchtime.
What time do you eat lunch?
Noon.
Noon. All right, 6:30, noon.
One at dinner time.
Okay, what time do you eat dinner?
6 o'clock.
6 o'clock.
One before I go to bed.
What time do you go to bed?
11 o'clock.
11 o'clock. All right, so 6:30, noon, 6, and 11. So you've actually kind of done those out pretty well. Those are roughly about 6 hours, 5-6 hours apart, okay? But now there's a time from 11 p.m. until 6:30 a.m., and that's going to be another 7.5 hours. So hopefully that's not too bad of a sort of thing. But we don't put that information on the bottle. We say, take 1 pill 4 times a day. So if you woke up and you took one at 6:30, and you brushed your teeth, and you had your shower, and you had your breakfast, and you took another one, and then you got in the car, and you went to work, and 20 minutes later, you took another one, and then you had a meeting and a coffee break, and you took another one, you took 1 pill 4 times a day. But between 6:30 and 9, you've taken all 4 of those pills. Probably not what the creators, the scientists who made these pills and the pharmaceutical company had intended for you to do. But that's up to your discretion. Thankfully for you, you knew enough or had the enough health literacy to be able to say, I should spread this out over the day. But we didn't communicate that message. We put a burden on the recipient of that prescription to make those choices and take those at the appropriate time. So we made an assumption with limited information that we put out, and we hoped for the best, or at least we just had a blind spot and said, well, we've told them 4 times a day, so therefore, thank you for being my unwilling guinea pig on there. So those are computational skills, okay? Also, how many people have kids or have had kids at some point, all right? And of course, if you've had kids, those kids have gotten sick at some point, right? So you've had some sort of cough syrup or medicine, something like that, where you had to say, all right, here's how old the kid is, here's how much they weigh, or here's how tall they are, and find something on a chart and figure out, do I give them a teaspoon, a tablespoon, do I give them 1 pill, 2 pills? And also, when we get the big, giant, monster gravy boat spoon out of our drawer, it's like, oh, okay, well, you've probably just given the kid 7 times more medicine than he actually needed. But these are all computational skills. They require numeracy, mathematics, adding, okay, and figuring out what's the space of time in between all of those. So these things all of a sudden aren't, quite as simple as they seem. Interpreting and evaluating risk, percentages. Risk is an abstract concept. What we know about people with limited literacy skills and limited health literacy skills is that they don't do well with abstract concepts, all right? Things that aren't here and now, right in front of me, things that involve percentages, things that involve future behavior, not real strong areas for people who have limited literacy and health literacy skills. So I'm not a smoker. Actually, I used to smoke, but I don't smoke now. But let's say, for the sake of argument, I'm a smoker, and I go into the doctor's office. And doctor looks at me and he goes, Villaire, for crying out loud, you gotta quit smoking. If you don't stop smoking, you have a 75% chance of getting lung cancer. A 75% chance of getting lung cancer. So what does that mean? Does that mean there's 4 lobes in my lung that maybe 3 out of the 4 of those are gonna get cancer? Does it mean, what are the factors that kind of affect that? What it really means is, in epidemiology, or the study of the diseases and how populations get diseases, that we've looked at all of the people who smoke, and then we looked at the number of those people who smoke who got cancer, and that number came up as, and I'm just pulling this out of the air, but 75%. That has to do with a big, major, large group of people that we've studied over time. It doesn't have anything to do with you particular, you in particular. But what it means is, I now have to figure out, what does that mean to me? Another way of communicating that information could be something like this. Villaire, you got to quit smoking. If you keep smoking, your chances of having cancer are up here. If you stop smoking, your chances may be down here. Oh, okay, now you're talking about me. Now you're talking about my chances, and I can understand this a little bit better. Whereas when you say 75%, it's just this number. Here's another example. So if you had a medical condition, and I said, here's 2 pills that could help you, that could treat your disease. One of them, will treat, the likelihood of it helping you is pretty low, but this other one is twice as good. It costs 3 times as much, but it's twice as good. Oh, I want the more expensive one. Well, all right, let's look at the numbers. The original pill might only help 2% of people, or you might have a 2% chance of this helping you. This pill, you have a 4% chance. Well, frankly, 2 and 4%, those are still pretty slim odds. Those are not really great numbers. But for me to say this one is twice as effective as that one is a correct statement. But it's taking the numbers and it's really sort of, I'm using those numbers for an effect so that I'm not really giving people accurate, actionable information. I'm just using percentages and numbers and ratios and those sorts of things, which are still in the abstract. Both of them are really terrible in terms of the ability, for them to really help me. But I heard this one's twice as good as that one, and that's as far as I decided I needed to go, and I went for that. So the whole thing about numbers, percentages, those concepts, very abstract ones, and those are difficult for most people to deal with, and especially those with limited health literacy. Self-efficacy, it's our ability to actually take care of ourselves. So if the doctor said, Villaire, you got diabetes, lay off the ice cream shakes, and here's what you got to start doing. Okay, well, all right. Can I go home and eat a cheeseburger? Well, self-efficacy is my ability to understand that I have diabetes, what affects that diabetes, and what are my goals. I have measurements called, hemoglobin A1C, and I need to look at those numbers and make sure that those numbers are going in the right direction. The only way I can do that, though, is if I understand why that's important and how to actually do that, and what are the factors that affect those numbers. That's diet, that's exercise, that's lifestyle, it's all those different things. If I don't get that explained to me in a way that I understand, I can't control that. I can have no or very limited self-efficacy. So health literacy, the self-efficacy component of health literacy is very important, and that speaks to the ability for us to understand as a first step what I need to do, what's wrong, what I need to do, why that's important, and how to go about doing that. Other considerations, culture and belief systems. I would venture to say virtually everybody in this room has had a different set of experiences growing up. Some of you may have grown up in the United States, some of you may have grown up in other countries, different religions, different philosophies, different racial, ethnic backgrounds, different socioeconomic statuses, live in different areas, more advantaged areas, more disadvantaged areas. All of those things make up who you are. And those are all things that you use as filters, okay? The language that you speak, everything. These are all components of your culture and your belief system. How many people have read a book called The Spirit Catches You and You Fall Down? It's an excellent, excellent book. It's The Spirit Catches You and You Fall Down. It's by Anne Fadiman. It's essentially the story of, it was up here in California, in Merced, of a Hmong family, H-M-O-N-G, Hmong family, whose daughter, they had a little daughter, and she had a seizure. And they took her to the local community hospital. And the doctor said, oh, okay, she's had a seizure, she needs to take this medicine. And they were like, no, this was a result of, the reason that she is in the state that she's in is because, according to our belief system, there was a loud noise that frightened her, and the spirit in her body came out, and another evil spirit captured that. And so now she is without that spirit within her, and that's why she's having all of these issues. So right off the bat, there was this mismatch in the belief systems, and unfortunately for the little girl and the family and everybody involved, what they didn't do was try to sit down and bring in a cultural broker, somebody who could, kind of have a foot in both of those worlds, and come to an agreement between both parties as to, well, all right, I understand you believe this, you believe that, we're going to do this treatment, but then we're also going to give you this medication, and maybe between the two, whatever, something that just worked for everybody. But those two systems fought one another, and unfortunately for the girl, it did not, obviously did not turn out well for her. So cultural awareness is kind of a first step. It's something that's a very important concept because we think differently, we speak differently, our experiences are different, and we need to respect that, celebrate that, frankly. And not have that be something that is, our way or the highway. And we're going to see some more examples of that during the whole 2 days of the conference and today. There's a mismatch quite often between provider demand and patient skill level. I'm asking you to do something, but you don't, I'm not communicating that in a way that you can understand how to do that. So therefore, there's a mismatch. I tell you, all right, you got to do this, 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 and this. All right, see you next week. Villaire, you're huge, you got to go lose 30 pounds. I'll see you in 3 weeks. All right, well, I could chop off my right leg. I guess that probably weighs about 30 pounds. I have no idea how to do that. There's a demand that's been put upon me, but I haven't been given the appropriate tools that I can understand and use and process to be able to carry out the request that you've made of me. So that's another component of health literacy. A mismatch between the reading level of materials, people's ability to read. We've heard that half the U.S. population reads at an 8th grade level or below. When you write materials for a Medicaid population, those have to be written at a 4th grade reading level. Quite often, even if that's the case, those are still beyond people's ability to read and comprehend. People who are poor readers don't like to read. So if you give them stuff that's printed, you're already kind of starting at a disadvantage. And even if they can read that, if it's in real tiny type and you've given them 18 pages, it ain't happening. It's not going to happen. So another component is that mismatch between what we're asking people to do and what they can actually read. Health literacy has a strong relation to health disparities, which are disadvantages that people face because of certain circumstances, whether it's their age, their ethnicity, where they grow up, what their environment looks like, their socioeconomic status, their education level. All of those elements play into your ability to get an even level playing field in terms of your access to care and your ability to get quality care. And there's a strong relation between health literacy and safety and quality. And there's been numerous studies that show outcomes to that effect. So people say, let's talk about equity and equality and what are the differences? Well, equality, so you can see in this picture, here's 3 kids that are trying to take a peek over the fence and see the ball game. Well, let's give them all a box. That's equality. Everybody gets a box. Well, guess what? That doesn't necessarily work for everybody because some people need a little more. They need a slightly different help. So the help that this person gets that allows them to see the ball game is not necessarily going to work for our friend on the end there. Equity is when we work toward achieving an outcome that everybody has access to health care. Everybody understands and is able to use that particular health care. Everybody gets the help they need to be able to successfully function as a patient, okay? So in this picture, this kind of demonstrates, and people will quibble with this, the specifics, but I think the concept shows us very well. Equality is not the same as equity. Equity is more about the outcome. Equality is more about the action, okay? So when we say health equity, what we're saying is that we have now created a level playing field where everybody has equal access and everybody can understand what is expected of them, and they're able to access and use the healthcare system appropriately. Okay, so what I'd like to do now is what I call an empathy exercise. People with limited health literacy skills, when they interact with the healthcare system, quite often they get this sort of glazed look over their eyes. People who are old enough to remember, how many remember the Peanuts holiday specials and the little cartoons, Charlie Brown and the Peanuts, right? And remember when the teacher talked, it was always, wah, 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 wah. All right. That's kind of what happens with folks, and we're going to see a video here that really amplifies this as well. But when we talk and we use jargon, words like hemorrhage instead of bleeding and cerebrovascular accident instead of stroke, all of a sudden people are like, they get that glazed look because we're using our words, not words that they can understand, okay? So in this empathy exercise, I want to see if I, just for a moment, can put you in the shoes of somebody with remarkably limited health literacy. So what we're going to do is we're going to take a quote from a journal on nuclear physics. How many nuclear physicists do we have in the room today? Oh, come on, there's always one wiseacre who puts his or her hand up. Nobody? Okay, no nuclear physicists. Cool, we're good. So this is from a nuclear physics journal. And what I want you, here's the purpose of this exercise. I want you to listen to this paragraph. I'm going to read you a paragraph. You can either read it or just close your eyes and listen as I read it. But I'm going to read you this paragraph. And at the end of that paragraph, I want you to ask yourself, did I understand what was just conveyed? Do I understand the message that this paragraph was trying to achieve or convey? And if you understand it, you get to live. If you don't understand it, dirt nap, okay? So, here we go. Ready? Transverse and longitudinal response functions have been extracted for helium-3, carbon-12, calcium-40, calcium-48, and iron-56 up to a momentum transfer of 550. The quenching of the longitudinal response function in the quasi-elastic region is significant and might be a signature of modification of the intrinsic properties of the nucleon in nuclear matter. How many people are going to die? Right, okay. So here we have a sentence that has some jargon in it, okay? The chemical phrases, right? Quasi-elastic, I can kind of understand that. Most of these words, if you kind of go through and look at each word, you could kind of say, yeah, I know what that word means, all right? We understand there's subjects, verbs, prepositional phrases, there's punctuation, there's capitalization. All the pieces, we can understand those. But when we put those together in context, and that context is intended to deliver a message, because we don't know the jargon, because we don't know the information, because we don't have the basic underlying understanding of the principles upon which this message was based, we don't understand this message. And so therefore, it has gone right past us. And so when we think about people with limited health literacy skills, think about how well I'm sure most of you all of you are very, very well educated in this room. Think about how you feel not understanding a fig of what is going on in this sentence. This happens to people with limited health literacy skills all the time, with so much of what we try to communicate whenever they intersect with the healthcare system. So if you take nothing else away from the talk tonight, think about how you feel in terms of understanding this, and then remember that when you're communicating with anybody regarding the healthcare system and you're interacting with them, with whatever it is you do. This is the result of limited health literacy. This is really what we're kind of up against when we are, trying to do things in our standard way of doing them without, thinking through and being, cognizant of who that is. So, you know what you mean, but does he? Doc said 1 glass of alcohol a day. I can live with that. Frankly, they'd be taking me out on a stretcher and digging the hole if I pulled that one down. But when we say 1 glass of alcohol a day, when we say take 1 pill 4 times a day, when we're not specific, we have left that up for interpretation. And that interpretation can be virtually anything we want. Well, clearly our friend here likes his whiskey, and so, yeah. So here are a few examples, and these are all taken from the literature. These are all for real examples. 89-year-old man with dementia, diagnosed with an ear infection and is prescribed an oral liquid antibiotic. His wife understands that he must take 1 teaspoon twice a day. After carefully studying the bottle's label and not finding administration instructions, she fills a teaspoon and pours it into his painful ear. Now, you can really look at this from a couple of different perspectives. One perspective is, yeah, that's funny. Well, in a way it is. In another way, it's the same thing as our example with our prescription medication. We did not tell her, take this orally, take it by mouth, drink it. Now, when you get a burn and you get aloe vera lotion or whatever, you put it on the burn, right? And if you have a cut, you put the antibiotic, whatever it is, and your Band-Aid right on the cut. It's not too far of a stretch to say that this liquid should have gone to where the site of the pain was. That was probably a reasonable assumption for her to make. But she had to make an assumption. And that's where the disconnect occurs. Because we did not tell her he needs to take the liquid, put it in this little cup up to this line, and tell him to drink that and do that 2 times a day, once at 8 o'clock in the morning and once at 8 o'clock at night. Then there's no confusion, as long as you're saying it in the language that he understands. Okay. Here's another one. Mr. G, 45, Hispanic immigrant, native Spanish language speaker, has a job health screening. He's told his blood pressure is high and he can't work until it's controlled. He's given a beta blocker and a diuretic and instructed to take each once a day. 1 week later, he presents at the emergency department. His blood pressure is very low and he's dizzy. The doctors can't figure out why. A Spanish language speaker in the ED asked him, how many pills did you take each day? 22, says Mr. G. In Spanish, once means 11. So here we have a native Spanish language speaker, doesn't read English, gets a prescription label in English, scans that label, doesn't understand any word except one. Oh, once. Okay, I got that. 11. So the question is, can limited health literacy kill you? In this instance, it very nearly did. Here's another example. A teaching hospital, an intern writes in the patient's problem section. So this is in the patient's problem section. What's wrong with the patient, okay? In the patient problem section, of the medical chart, he writes, speaks no English. The attending physician writes a note back in response, your problem, not his. The fact that somebody coming to us for care does not speak the language that we speak is not their problem. It's a circumstance that exists. It's a barrier. It's a challenge for us. Therefore, if I'm the intern and I speak only English and somebody comes to me for care and speaks only Spanish, I have a problem now. That person doesn't have a problem. I have a problem because it's my duty to give care and I need to be able to communicate with this person and I can't. So language access all of a sudden becomes a health literacy issue and something that we need to deal with. It's not their problem. It is our responsibility. So when we go back to our definitions of health literacy, here's where the health system's responsibility comes into play in circumstances just like this, all right? So now I'm going to show you a video. Some of you may have already seen this one. It's just an edited version. It's about 5 minutes long. And this was produced by the AMA Foundation. And it's from a program called Help Your Patients Understand. Originally it was called You Can't Tell by Looking. But this is in the video what you're going to see are people with limited literacy skills, limited health literacy, and interviews, and with them telling you their own stories, okay? So this is the part where we put the human face on all of this. So what I'd like for you to do, watch this video, and at the end, I want to ask you your reactions about some of these people and what really struck you in terms of what these people had to say. So what you're going to see for each one, they'll show you their name, what they do for a living, and at what grade level they actually read, okay? So let's watch the video, and then we'll get your reactions afterward.
Missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Can you imagine what it's like, you being a patient and sick, and you know that you have limited skills, okay? And you're talking to an intelligent doctor like yourselves. And these people are using words that you really don't know because they're not speaking in layman's term, okay?
Right.
Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room with this intelligent woman or man thinking, God, I hope I don't make a mistake with my medicine because I did not understand anything he or she said to me.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is. That
Twice?
Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Which one is which and what you take them for?
That looks like my medicine that he gave me for the morning. I take that and the little pill that, oh, this is this is Lipian, isn't it? Yeah, that's Lipian.
Okay. And what do you take that medicine for?
Don't ask me. He puts me
Okay.
on there and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it with my life.
Hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered. Hypered.
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure.
Mm-hmm.
Okay. But hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
You have panic attacks. Did I do it right? Is this done right? Am I imagining things? Do I go back over and check it again? I've caught mistakes that I made, simple mistakes.
It paralyzes your thoughts completely to think that you may say something or something is put before you to read and you can't read it. I mean, you live with that on a daily basis.
People sooner or later will discover, and that is your most greatest fear. Mm-hmm. What day is it going to be when somebody discovers you can't read and write?
I would get mad about something and blame them that this is not the right place for me, you're not respecting me, and walk out. And it had nothing to do with that. It was just I need to cover that I couldn't read this. I didn't want them to know that I'm walking out because I can't read.
So you found solutions that sort of make it work and hide the real problem.
Yes.
So that others won't notice.
Right.
Doesn't that take a lot of your time?
Yes.
Doesn't it take a lot of effort for
A
you?
lot. Very emotionally. Yep.
It drains you?
Yep.
I am married to an engineer now, and this man has some health issues, so we are in the doctor's office from time to time. We will walk out of the doctor's office, and my husband, with all of that left-brained intellect, will say to me, what did the doctor say? What am I supposed to do? I don't understand.
I'm going to say, well, one of the things that you can do if you have a really bad pain, I mean, where you can't stand on it and it's really getting in your way, is to use what I call, this is my little pain protocol here. It has ibuprofen, which decreases those little cells I was talking to you about, the inflamed part, and your Tylenol that just works on the pain. Yeah. And the I is for ibuprofen and T is for Tylenol. And this just shows you how to do it over the course of the day. For breakfast, lunch, and dinner, there's an I, so you use ibuprofen.
Right.
Because you have to have something on your stomach.
That's right.
With that one.
Yeah.
Because this one will irritate your stomach.
Yeah.
So in between meals and at bedtime, you use the Tylenol.
Right.
This way you get something every 3 hours. You don't overdose on either one. So it's IT, IT, IT. And if you do that for a couple of days when it's really bad, then you can just go back to your regular regimen. But this usually breaks the pain pretty nicely. So I know you have a lot of friends with arthritis. How would you explain it to them?
Well, for breakfast, I take I. 10 a.m., I take T. Lunch, I take I. 3 p.m. I take tea, I at dinner, and tea at bedtime. Is that correct,
That's
Doctor?
going to work just fine.
Okay. Okay, so some thoughts. Yes? Shame. Yes. Yes. Thank you. Yeah, she said shame, and that is sort of what is preventing them from asking questions or what have you. And you're right, shame is a remarkably powerful motivator. We're going to look at some statistics about that, but that is a major, major issue for people with limited literacy skills. Thank you. Others, thoughts about the video? Yes?
Limited literacy does not have a look or an age.
Right? Absolutely. Yeah, in fact, that's what I was saying, is that the original title of this video was You Can't Always Tell by Looking. And these folks are respected deacon, craftsman, pharmacy tech. I mean, you saw what they do for a living. These are, folks, your neighbors. And it's not like, oh, those are the people who live over there. And those are the ones who, yeah, that's them. We don't have any low literacy issues in Beverly Hills. Well, frankly, you do. I'm sorry to break your bubble. Yes, Calvin.
I feel shame. I don't know how many times I've talked over people's heads. When I became involved in this, I'm sitting here with a master's in 60 hours, and I talk to ordinary people. I don't know how many of them didn't know what the hell I was talking about.
Right.
And now I feel shame.
Right. And
Myself.
I don't know what you're talking about, so I'm just... No, you're absolutely right. And I mean, that's, there are both sides of this particular equation. And hopefully that's part of what we're going to learn in these next couple of days, is to understand to put ourselves in those other folks' shoes. And to understand there are ways to communicate. There's work that we can do to make sure that that message is going to be received, understood, and actionable. A couple of other thoughts. Yes? Mm-hmm.
I was thinking that we use Epic, and so how come we still have people doing paper forms before they even go through their vitals? How can we integrate our EMR?
Right.
But to what you said about not having a major case, that video didn't have any refugees. And we have a large Eritrean, Somalian, Karenni population.
Yes.
A whole different level of
Right. Oh, no, absolutely. You're right. And I mean, it is so widespread. And and actually in a few slides, we're going to look at incidence and prevalence of all of this. But you're absolutely right. I mean, these are just, so I think the purpose for this video is just to sort of say, here are some folks that you kind of bump into at the grocery store and whatever. And it's not this, they don't have the scarlet letter, okay? That we can't tell that these are the folks who are experiencing that. Any other last thoughts? Yes? Yes. No, absolutely. You're absolutely right. I'll tell you a couple of things that I noticed on this one to exactly build upon your point. The very first lady, she says, I've taken prescriptions wrong in the past. I admit it. I admit it? I mean, usually it's like, oh, I forgot your anniversary. I admit it. I mean, that was a thing that I did actively that was, avoidable. But frankly, if she doesn't understand the language, or if we're not giving her adequate information on how to take that correctly, that is not her fault. That is not something she did willfully and incorrectly. This was a failure on the part of the system. And I mean, everybody has a shared responsibility in that. The other one was, you notice the one woman who says, I just take anything he tells me to. But you notice when she was looking at her prescriptions, what was she doing? She was opening up the bottle, shaking the pills out, and looking at the pills. She wasn't reading the label on the bottle. So when, how many people here are clinicians and work in a clinical setting? Okay, so a lot of times, those are some of the cues, those are some of the things that might raise your awareness about, oh, perhaps we're dealing with somebody with some limited literacy skills here. Okay, thank you for sharing those thoughts on that. Let's move along here. All right, pop quiz time. Wait a minute, you didn't tell me there was going to be a pop quiz? All right. So, Here's our pop quiz. Which of the following is the strongest predictor of an individual's health status? In other words, if we know this about them, we can tell something very specific about their health status. How many people think it's age? The older you are, the less healthy you are. Well, those old folks like Villaire, they're just not healthy at all. Nope, no takers, okay. Income. Rich people are healthy, poor people are less healthy. All right, we got a few voting for that one. Literacy skills. If you have good literacy skills, you're probably healthy, low. All right, we got a few more for that one. Employment status. The people who are employed probably are healthier than the people who are not employed. All right, education level. If you finished high school and you went to college, you probably can figure this stuff out better. Can't tempt anybody with that one. Okay, one in the back, thank you. Racial or ethnic group. These guys over here are better than these guys over there. Nope. I think people just have a sore arm and they don't want to raise it. Okay. Literacy skills. Test taking 101. It's a lecture about literacy, so of course that's going to be the answer. This is from a study. 75% of those who self-reported poor health fell into the below basic health literacy category. So when people were asking, tell me how your health is, if they said, my health is poor, the likelihood is 75% that they were in the below basic health literacy category. All right? A few myths. People who can't read can't learn. Of course they can learn. They just have different ways of learning. We have to work with them and figure those out. Let's demonstrate it. Let's use TeachBack. That was the very last little vignette on the video when she was talking about her pain protocol and the ibuprofen and the Tylenol. And she said, okay, I know you have a lot of friends who have arthritis. How are you going to tell them? What are you going to tell them when you go home about what your thing was? That's TeachBack. Tell me in your own words what you understand to be your particular instructions. So yes, of course, everybody can learn. They just may not be able to learn by reading something that's written at a 12th grade level. Most people who are illiterate are immigrants or minorities. Right here, you're actually looking at the poster boy right here. White, male, what have you. When we look at just numbers, this is your face of limited literacy and health literacy. There are certain areas or categories where people may have a higher incidence of limited literacy, limited health literacy. People 65 and older tend to have lower health literacy levels or scores. It doesn't mean if you're over 65 you've got poor health literacy. It means that within certain groups there may be a greater tendency toward that. But those are in smaller groups and those are tendencies, okay? If someone can't read and I give them written instructions, they'll tell me they can't read. We just saw some really good examples of that in this video that, frankly, what was the terminology they were using? This is my greatest fear. It's my worst nightmare, the day that somebody's going to find out, which speaks to shame, exactly as you were saying. I can tell how well someone can read by the number of years they attended school. Well, again, we saw a few of those people who graduated high school reading at what, 4th grade, 5th grade, 6th grade level? So no, just because you finish high school just means you finish high school. And my favorite one, yeah, health literacy, that's just dumbing it down. Just stop. Because the more you talk, the more you embarrass yourself. No, it's not dumbing it down. It's taking into account abilities of individuals to communicate in a way that works for them, all right? It's not dumbing it down. And you may feel free to show them the picture of this. Is that a lemur? I have no idea what that guy is. But he's hilarious. I just love that picture. All right, so we're going to look at a few statistics here very quickly, so we get a sense of overall incidence and how many of these, where does this problem really lie in terms of statistics? So, two major studies that were done to determine literacy and health literacy in the United States. 1992, the National Adult Literacy Survey, strictly literacy assessment. In 2003, the NAAL, the National Assessment of Adult Literacy, added a health literacy module. Of course, it's very difficult to compare one to the other because in the NAALs, there were 5 levels, and in the NAAL, there were 4 levels. Why would we want to make any kind of concordance between those? I'm just saying, though. And no further NAAL is going to be done. There's another study that does internationally statistics. It's called the PIAC. Okay, so here are the 4 literacy levels from the NAAL. Below basic, basic, intermediate, and proficient. Essentially, in order to function within the healthcare system, you really function completely and effectively and be able to move through and understand everything, you need to be at the proficient level. okay? Anything less than that, there are pieces that you are going to end up missing out on, all right? So here's the literacy component from the NAAL, the percent of U.S. adult population with below basic or basic, so the bottom two scores. Prose literacy, this is your ability just to read sentences, paragraphs, reading a newspaper, what have you. 44%. 44% of the adult population falls into the bottom two categories in that literacy, below basic or basic. Document literacy, this is your ability to find information on a page, whether that's a bus schedule, a dosing chart, anything where you have to search and understand where a piece of information is located, that's called document literacy. 34%, so 1 in 3 adults fall into the bottom two categories. And then quantitative literacy, also known as numeracy, which we talked about in the very beginning, and which I said was quite problematic. Here's your reason why. 55%, more than half of the U.S. adult population fall into the bottom two categories when it comes to their ability to figure out information that has to do with numbers, percentages, anything having to do with calculations, statistics, anything along those lines. So here's a quick couple of infographics from our buddies at Communicate Health. Thank you, Stacy and Zampi. Health information for the 90%. We all need information about our health, all right, but most of us can't understand it. More than 1 in 2 adults cannot use a BMI. How many people know what a BMI graph is? Body mass index? Okay, so just like I think I'm in the extra chubby side of that. So it's like, okay, BMI tells you what your healthy weight is. More than 1 in 2 adults can't use that, understand a vaccination chart, or read a drug label. Older adults are 3 times more likely to have below basic health literacy skills than adults 16 to 49. Hispanic Latino adults, 4 times more likely to have below basic health literacy typo there. People with poor health are 5 times more likely to have below basic health literacy skills than people with good health. So these are some of these statistics. In these particular groups, does not mean if you are elderly, does not mean if you are Hispanic, that you have limited health literacy skills. It means within these particular categories. And there are other ones as well. These are just the ones in the example. So 10%, it's actually 12%, only 12% of adults have the skills needed to use health information. So that means about 1 in 10 people are proficient. So the question is, what about the rest of us? What about the other 9 in 10? They struggle with the healthcare system. They struggle when they intersect with the healthcare system. And whether that's health insurance, whether that's following instructions, whether that's taking care of yourself, whether it's understanding you have to get a screening, lifestyle choices, any of those sorts of things. Stir in a few other facts and figures. 381 languages spoken or signed in the United States. 40 million foreign-born people living in the United States. 60 million Americans speak a language other than English at home. 24 million Americans have limited English proficiency. And here's the most insidious one of all. 75 to 90% of patients in the 2 lowest reading levels describe themselves as being able to read or write English well or very well. They are not going to tell you they are poor readers. They just aren't. It's not going to happen. All right? Oh, and then there's cognitive impairment, communication disorders, learning disorders, hearing, visual impairments. I have to wear my glasses to see distance. Some people need glasses to read things close up. If they don't have those, that's kind of tough for them to read information. Medications, there's medications that make you foggy, make you unable to really understand and function appropriately. Stress. Most people forget at least 50% of what healthcare providers told them when they were in the office. You saw the story from Toni Cordell, her husband, who's the engineer. He walked out and said, "What did the doctor say?" That's not an uncommon story. That's actually fairly common, very common. And now here's our statistics on shame. Shame regarding illiteracy, 78% thought they should hide it or just cope. 77% never told their doctor. 2 out of 3, 67% never told their spouse. Never told their spouse that they're illiterate. And 19%, about 1 in 5, never told anybody. All right, Doc, enough with the English. Just give it to me in plain academic medical terminology. Yeah, that happens all the time, right? Okay. Why does health literacy matter? Well, those with limited literacy skills report poorer overall health. They have a poorer ability to manage their chronic diseases, and when we start talking about the cost of managing chronic disease shortly, we'll see why that's important. They tend to have poorer outcomes. People with limited literacy skills are less likely to understand their diagnosis. They're less likely to go in early for screening and preventive care, and they tend to present in later stages of disease when it's tougher to treat. And they are more likely to be hospitalized, and when they are discharged, they are more likely to not understand their discharge instructions and be rehospitalized. So when we talk about cost, early studies showed about $73 billion in unnecessary costs annually directly attributable to limited literacy and health literacy skills. 73 billion, and that was in 2003. More recent study, 106 to $238 billion in unnecessary costs annually because of limited literacy skills. In 2007 dollars, that was about somewhere between 12 and 15% of all healthcare expenditures wasted because people did not understand the instructions that were given to them. And then we look at chronic disease, which we saw the incidence of. About 75 cents out of every healthcare dollar is spent on managing chronic illness. 1 in 2 Americans live with a chronic disease. 90% of those 65 and older have a chronic disease. 77% of them have 2 or more. So we start connecting the dots here. The cost of chronic disease management, the literacy levels of people who have those diseases, the prevalence of those diseases, the amount of money we spend on managing chronic diseases, and the ability for people to understand and manage those is so poor. It's the perfect storm. So the people, for instance, who are in that 65 years of age and older category, who tend to have the greatest incidence of chronic disease management, in many instances are the ones who are least prepared and able to manage those chronic diseases. All right? And 7 out of 10 annual deaths are because of chronic disease. So the rest of the presentation has some management, some strategies on here. We're getting fairly close to our end time. So all of these are on your slides. These are things that really are a little more for people who are in a clinical situation. But what you're going to experience here at this conference is solutions. That's what we're about here, okay? So you're going to hopefully learn some skills, you're going to learn some tactics, you're going to have your awareness raised, and frankly, if nothing else happens when you walk out of this conference, if you walk out of here with a greater awareness of the scope and the magnitude of this problem and what your particular role is in terms of trying to ease some of those problems, those burdens, those issues, and you have conversations with the people with whom you work, and you understand what the abilities and the ability of the people with whom you're trying to communicate is to understand your message, and you take just a little different tack, and you understand that the message that you're giving out there, the expectations that you have, may not just be able to be matched because you put that out there, because you gave somebody a piece of paper, because you said your speech, because you gave them something to do, does not mean that they understand it. It does not mean that they can effectively carry out those instructions that you asked. There's so much more behind that. And that's where the challenge comes in. But because you're here at this conference means you care about that. And so hopefully over the next couple of days, you're going to learn a lot more about how to do that. And again, these are all in your materials, so I'm not going to go over each one of these. A couple of websites, and there we are. So thank you very much for being here. I'm happy to take any questions now. Raise your hand. Okay, going once. Yes, just under the wire. Yes. Yes. It's a company, yes, and they do a lot of work in health literacy. They do really, really great work. I think they're teaching a class this time around, Amy, yes? Okay. Yeah, so Stacy Robison and Xanthi Scrimgeour are the 2 principals from that company. They do excellent, outstanding work. They're great, great friends of ours, and they're here just about every year. So if you see them, tell them Michael sent you. And yes, you can certainly get a copy of that infographic. Very good for communicating these kinds of facts and figures. Other questions? I thought I saw another hand up. Somebody was just stretching and yawning. Is that it? It's late. Any other questions? Going once, going twice, going 3, 4. Thank you so much for being here. I really appreciate it. And I hope you guys enjoy the rest of your conference. I will be here for a few minutes. Just so you know, the main part of the conference starts in this room tomorrow morning, 8 a.m. So no getting crazy out there tonight. Wait till Friday night, then you can get crazy. But tonight, early bedtime. All right, thank you very much.